Scottish folds are famous for their cute folded ears and round teddy bear faces. But behind that cuteness, many of them are born with serious genetic problems. In this video, we'll talk about the main genetic disease almost every Scottish fold is at risk of two other common hereditary diseases, and how to manage and care for a Scottish fold who has these conditions. This video is for information and awareness only. If you suspect your cat is in pain or ill, always talk to your veterinarian. Scottish folds aren't just cats with folded ears. That ear fold comes from a dominant gene mutation that affects cartilage and bone, not just the ears. If one parent is a Scottish fold, the kittens have about 50% risk of getting the gene. If both parents are Scottish folds, the risk of genetic disease can go up to almost 100%. That's why responsible breeders and many vets strongly oppose breeding fold X-fold. The same gene that folds the ears can also damage the joints, the spine, and even contribute to other health problems over time. The most famous Scottish fold genetic disease is called Osteochondrodysplasia, a disorder of the bones and cartilage. Not every Scottish fold shows severe symptoms, but the risk is much higher than in other breeds because of that ear fold gene. Researchers compared Scottish folds with other cat breeds and found a specific mutation in the TRPV4 gene. This gene is important for cell growth and tissue balance. The mutation can cause short, curved bones in the legs and toes. Extra, abnormal bone can form around the joints, making them stiff and painful. So the ear fold isn't a harmless design. It's actually a visible sign that the cat may have problems in the whole skeleton. If your Scottish fold shows any of these signs, it could be osteochondrodysplasia, legs that look thick or deformed, a short, stiff tail that doesn't bend easily, limping or an unusual way of walking, complaining or reacting when you touch the legs or tail, hesitating to jump, or stopping in front of a high place, struggling to land smoothly after jumping. These are often signs of joint pain and chronic arthritis. You'll sometimes hear two terms, homozygous fold, FD-FD. Both parents are Scottish folds. The kitten has two copies of the fold gene. Almost 100% of these cats develop severe osteochondrodysplasia. Symptoms can start as early as 7 weeks old. Joints may become so damaged that the body looks twisted or deformed. Tail becomes very stiff, and the cat avoids climbing or jumping. Heterozygous fold, FD-FD. Only one parent is a Scottish fold. The cat has one fold gene and one normal gene. Symptoms usually appear later, around 6 months or more. The disease may be less dramatic, but there is still bone and joint damage. In both cases, this is a lifelong condition. There is no cure, only management of pain and symptoms. Scottish folds are also prone to other hereditary diseases. Polycystic kidney disease means the cat's kidneys develop many fluid-filled cysts. These cysts can also appear in the liver or pancreas. Over time, they grow larger and more numerous. This leads to chronic kidney disease, CKD. Breeds with higher risk include Scottish fold, British shorthair ragdoll, especially Persian cats and their relatives. There's no way to reverse this disease. Vets usually focus on fluids, subcutaneous or IV, kidney support supplements, a diet that helps maintain kidney function. The goal is to slow down progression, not cure it. Hypertrophic cardiomyopathy, or HCM, is a disease where the heart walls become abnormally thick. This makes it harder for the heart to pump blood properly. Breeds at higher risk include Ragdoll Maine, Coon, Devon, Rex, and Scottish Fold. Common effects: poor blood circulation, fluid buildup in the lungs or around the heart, fast breathing or rapid heartbeat. With HCM, vets may prescribe medications to improve blood flow, drugs that help relax the heart muscle, medicines that slow the heart rate. Again, it's usually a lifelong condition that needs careful monitoring. Even if there's no cure, you can do a lot to improve your cat's quality of life. Ask the breeder or shelter about genetic testing. Check if the parents were screened for TRPV4, PKD, HCM. Avoid any breeding where both parents are Scottish Folds. If possible, choose Fold X, non-fold crossbred kittens only, or consider other breeds with lower genetic risk. If your cat has already been diagnosed or shows suspicious signs, regular vet checkups, blood work, x-rays, ultrasound if needed, consider neutering or spaying to prevent passing on the genes. Follow your vet's plan for pain control and joint support. Extra weight means extra pressure on weak joints. Keep your cat at a healthy weight. Control meal portions and avoid free feeding. Use joint-friendly play, short, frequent play sessions. Avoid extreme jumping or harsh landings. Aim for about 2 to 3 sessions a day, 10-15 minutes each. The goal is gentle movement, not intense workouts. Because of joint pain, many Scottish Folds hesitate to jump to high places, struggle to climb into tall litter boxes. You can help by using low, multi-level cat trees or cat poles, providing ramps or steps to favorite spots, placing several low-sided litter boxes around the home, adding a small step or platform at the litter box entrance. This reduces their need to jump and helps them move without pain. If they can't step over a high litter box rim, they may hold their urine or stool, or start having accidents in other places. So a low entrance makes a huge difference for their comfort and dignity. Scottish Folds are incredibly charming, loving companions, but many of them pay a high price in health for their cute appearance. If you're thinking of adopting a Scottish Fold, please do it responsibly. Ask questions about genetic testing and be ready to give them special care for life. If you already share your life with a Scottish Fold, watch for the signs we talked about. Work closely with your veterinarian and make your home a place where your cat can live comfortably and pain-free. If you found this video helpful, please like, subscribe, and share it with other cat lovers so more people can understand the truth about Scottish Fold genetics.